Okay, so we're going to go through a couple of exercises, and I'm going to turn it over to Tony. We're on page 123. So I need some interaction here. The patient should be saying, is a 40-year-old male who's referred for purposes of an IME. The independent medical exam process explained to him. He understands that there's no physician-patient relationship. The patient was advised, blah, blah, blah. The patient arrived at 2:30. The patient left at 5 o'clock, and so on. How did the IME physician create liability for himself? Kept on using patient, okay? So that's an easy one. We'll get to harder ones. On page 125, these are actually actual statements from reports we've seen in the past, believe it or not. Example 1, therefore, based upon the foregoing to a reasonable degree of medical certainty, is my opinion that the 28203 work accident cannot be ruled out as a possible aggravation of the examinee's multiple sclerosis. Okay, so what's wrong here? Hedging. What's the hedging? Cannot be ruled out as totally legally insufficient. A lot of things can't be ruled out. For a possible aggravation, what the hell is a possible aggravation? It's like possibly being pregnant. Either you have an aggravation or you don't. Okay, no possible aggravation. That's out. This report thrown in the garbage, no good. Insurance company gets pissed off. It should say, to a reasonable degree of medical certainty, this person aggravated his multiple sclerosis or did not aggravate his multiple sclerosis. If you can't make, well, they're asking you to make an opinion, either it's related or it isn't related. If you can't give the answer, if you're not competent or you don't have enough information, no, if you're not qualified. Okay, let's not fight with me. I'm trying to be helpful. You're there to solve problems, not create them, okay? There's 3 million cases coming along the conveyor belt. They're sending you, you're an orthopedic doctor, they're sending you a person with a broken foot, okay? Okay? Well, we'll start with the easy ones. We'll get to the harder ones later. They're sending you a person with a broken foot, and they ask you, can this person now currently go back to work as a tap dancer? The answer is no, he has a broken foot, okay? Now, it gets more difficult. The person has a fusion, okay? A lumbar fusion. Okay, can this person go back to a heavy laboring job where he lifts 50 pounds or 100 pounds? That's more difficult, okay? But they want your opinion to a reasonable degree of medical certainty. Either you have an opinion, either yes or no, but if you don't have an opinion, for whatever reason, you need to tell them, I do not have an opinion in this case. I can't offer you an opinion. However, if you continue to do that in cases, they won't use you because they need to get the answer, okay? So I'm not being flip. In other words, they have to get an answer. They have to either pay this person who's starving to death or not pay them. And they can't say, my doctor can't make up his mind, and we have to put everything on hold. So there may be, again, you don't need absolute certainty, over 50%, okay? So most of the time, 95% of the time, the IME doctor offers an opinion, one way or the other. There'll be 5% of the time when perhaps you can't do that because you don't have enough information. But if you continue to say that I don't have enough information or I can't offer an opinion, then they're just going to send the person to somebody else, okay? Yes? Right, foregoing is a very poor word. What does foregoing mean? It's like forsaken? I mean, no, foregoing is a very poor phrase. Yes, it should be based upon these records. Yes, absolutely. Okay, number 2. It would seem to me, therefore, that the treatment rendered present was not reasonable or necessary. What's wrong with that? Seemed to me. This is all red flags. See how you're diagnosing these now? Next one. I do not think the revision of the total knee arthroplasties that took place was necessitated by the accident itself. What's wrong with that? I not think. That's not an opinion. Next one. I do not believe. Right? Same thing. So this is the kind of thing when you do your reports, you're going to edit these out now. You have this knowledge, and you're going to say, no, this is not going to fly. It's not going to fly. Based on the foregoing, to a reasonable degree of medical certainty, the following conclusions can be made. Okay? That's the passive voice. Just state what they are. Don't say you can be made. State what they are. That's a little more subtle. Number 6, page 126. It can be argued that the vast majority of the treatment received to date was not necessary. Not necessarily. whatever, typo. Okay. It cannot be argued. I mean, it can be argued, again, wrong. Number 7, it would be my opinion. Wrong. Okay. Number 8, based on my examination, I would feel. Nobody's asking you about your feelings, okay? Nobody's asking you or paying you for your feelings. Number 9, it's my medical opinion based on my reasonable amount of certainty that no further orthopedic care is not indicated. What is that, a double negative? No further care is not negative. So what do we have to do? We have to figure out with a freaking chart what you're talking about? It's not indicated, it is indicated. You have to have arrows. No, just state what it is, okay? Don't use double negatives so nobody can figure out what the hell you're talking about. Number 10, the aforementioned diagnoses and their causes are stated on a more probable than not basis, where possible, but must be qualified by adding that most of the former are based primarily, if not exclusively, upon subjective complaints and or physical findings which can neither be confirmed nor denied. Okay, so this is like pull out the loaded gun and blow your brains out when you get this report, okay? You have a $500,000 case, somebody sends you this. And the real problem is that a lot of times they're not allowed to trash these reports. They have to keep them in the file. And they may be required to send it to the other side. When the plaintiff's lawyer gets this, he's laughing all the way to the bank. What the hell? I just can't wait to depose this guy. I mean, this is going to be great. We're going to have a high old time with this report. It's going to be fantastic. I'm going to love it. Okay. 127. When asked his opinion on causation, the physician stated, it appears at this time. That's a parenthetical remark. Out. Okay? Nobody cares what appears. The complaints may be consistent, wrong, with the mechanism of injury that she described from 7/15/12, and that which is documented in her medical records that have been provided for my review today. Hence, we don't really need the hence. The mechanism of injury, work injury, as described in the following position, appear to be consistent with causation. Wrong, 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 wrong. Of no use. Legally insufficient. Okay? Thrown in the trash. And I think the last one is the best one. Okay? This is always my favorite. Okay, so this 129 has every mistake you can make in writing a report. This is an actual report. We're going to cover this. Okay, and this is the one with a lot of parenthetical remarks. Ask a question about whether the claim was permanently disabled. Answer, it is indeed a difficult opinion to give. Okay, strike it out. Of no value. As it may be in many chronic pain cases. Very little value. There's a great deal of subjective input from the claimants. Yes, we know that, of patients regarding their issues. It is difficult to make it, okay, don't tell us how difficult it is. If it was easy, we wouldn't have sent the case to you. Yes, I understand it's difficult. Be that as it may, okay? When I went to school, the New Utrecht High School, okay, in Brooklyn, if you handed something like this, my teacher would not only put an F, he'd put like 3 Fs on top. I mean, you might actually get demoted back to the 9th grade for handing this in, okay? F, 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 it would be on the top, okay? Be that as it may, parenthetical remark, that's out. I would go to give the claim in the case the benefit of the doubt. Okay, you're not supposed to give anybody the benefit of the doubt. I mean, you're not allowed to give people the benefit of the doubt. Out, completely wrong. That he is presumably permanently disabled. Here we go again. Okay, so what does that mean? You're presuming, you give him the benefit of the doubt, and then you're presuming he's disabled? That's what we asked you to tell us about. The reason I say this, another parenthetical remark, strike that out, okay? The claimant complains of fairly significant pain, as brought up by Dr. Shadell. There may be some discrepancies even in the claimant's medical records, as they are documented. Well, wait a second, now he's talking about a conspiracy here. I mean, he's there to solve problems. Now he's talking about a medical record conspiracy, okay? There may have been changes to these records. Okay, so we have to call in, the special counsel here. As there's documentation of the arm pain improved, I'm not sure that changed the per revisions. This makes me suspect, okay, you're not Sherlock Holmes here. They ask you a simple question. Despite that, parenthetical remark, strike that out, okay? I have to consider repeated visits by the doctor, 10/10. He requires ongoing pain medication, which may alter his ability to think clearly. May is not helpful, and make adequate decisions and evaluations of patients that he sees. But then he comes with a powerful last sentence, okay, which solves all the problems. This is a difficult situation, to say the least. Okay, so what you have now is you had a $50,000 case that's now worth about $500,000. If they have to hand this in to the other side is going to love it, just love it, okay? So I know we went through a lot of exercises here. I'm going to turn it over to Tony now. These are the kinds of mistakes you want to avoid when writing your report. Now you've been exposed to these things. Now if you do what I suggested and print up your report so you can edit them out with a red pen, at least the first few times, you'll get used to it and you'll avoid this terminology.